Got it. And for anyone listening, especially if you're driving, don't worry about writing all these down. Everything she said is going to be in the show notes, but I'm also going to link to EverlyWell and a special link for you guys. So make sure you check that out in the show notes. I'd love to also go a little deeper on, from a physician's perspective, what to do when you get lab results that aren't normal. Because I know from a patient's perspective, that can be very scary, especially when you just see that something's wrong or off. So what would you say to someone who maybe is testing and getting abnormal lab results?
Sure. I mean, the first thing that I would say is none of our tests are testing for conditions that are immediately life-threatening, right? We don't have a test to tell you whether or not you're having a heart attack. We have a test that will look at your cholesterol and lipid profile and tell you whether or not you would be at an increased risk of having heart disease if you didn't do anything about, the abnormalities that you got. So the first thing is nothing is immediately life-threatening. So with all of our test results, don't panic. Even if it's abnormal, it's good news in the sense that you've figured out why you're having the symptoms that you're having. And now you have, sort of the impetus to go make that doctor's appointment, keep that doctor's appointment. Don't forget about it. Don't skip it because, I skipped it because there was something going on at my kid's school that was more important. I mean, this is the time when you have to say, okay, my health is really important and I need to put a little investment in me. Otherwise, I'm not going to be able to be around here to take care of my family, like in the manner that I want to, because I'm going to be tired all the time, or I'm going to gain so much weight that I don't want to go in a bathing suit and go to the town pool with my kids, or whatever it may be. But so I always say, don't panic, but make the appointment and make the commitment to you and to your health to get this looked at. And then if you come to me, depending on what the testing result is, some of our tests are screening tests. And so they're not diagnosing a condition. They're screening people to see if they may be at risk for problems with their health and problems with their wellness. So the first thing that may happen is I may do more testing. And it doesn't mean that I didn't trust the testing that you had. It means that if you, let's say you're a man and you do the men's health test and everything on your men's health test is normal except for your TSH. Well, I have to do additional thyroid testing on you because you didn't do it yourself. You just did the men's health test so that I could see what exactly is wrong with your thyroid so then we can go ahead and treat it. If you did the men's health test and your TSH was wrong and you went, my TSH is wrong, maybe I should do the thyroid test now and see what's going on with my thyroid, and you came to me with thyroid results, then we could make the treatment plan from the thyroid results because you took the first step and the second step. So a lot of it's just going to depend upon how far did our customer go with sort of their investigation before they went to the doctor. So the more information that I have, the more time I have to just say, okay, here's what your thyroid results show. This is the condition that this indicates that you have. This is how this condition is treated. This is what I think we're going to do. So it's going to be individualized. Some people may say, I have an abnormal TSH. Okay, I identified there's a problem. Now I want my doctor to do the rest of the testing. And that's also perfectly fine because our testing is just meant to fit into what works best for your lifestyle and what works best for your health and wellness. But again, first thing is always don't panic. You're not going to open up your results and it's going to say you're in the middle of having a heart attack, go directly to the ER. And we don't do that type of testing. So there's nothing that's going to be immediately life-threatening.
Yeah, that's great perspective. Are there certain conditions that you guys see, because I'm sure you must get a lot of health data, that seem to be more on the rise in general, or is it really kind of across the board?
Well, I will say that in general, thyroid disorders seem to be very common, obviously more common in women. One thing that I think is very interesting is if I said to you as a woman, if I told you you had a 1 in 8 risk of blank, can you fill in the blank?
Is it breast cancer or heart disease?
It's breast cancer, right? So 1 out of every 8 women in their lifetime have a risk of getting breast cancer. Interestingly enough, it's the same statistic for women getting a thyroid disorder. So 1 out of every 8 women in their lifetime will develop a thyroid disorder. But women don't know that statistic. We all know the breast cancer. And a lot of it's been education and a lot of organizations that are rising the awareness of breast cancer. But just to put it in perspective, you're just as likely to get a thyroid disorder as you are to get breast cancer. I think that we tend to see a lot of thyroid disorder in people. We tend to see it also in a lot of younger people. Testing for thyroid in general, just as part of your wellness screening with your doctor, doesn't start until the age of 35. Now, you will get an initial thyroid screen in every pregnancy because it's really important to identify thyroid disorders in pregnancy because it can actually affect the developing fetus. But if you don't get pregnant before 35, you may never get screened for a thyroid disorder until you're 35, unless you're symptomatic. So I think that that's something that's very interesting. I definitely answer a lot of questions from our customers about their thyroid results. And it does seem to be one of the more common abnormalities that I field just with customer service. Obviously, we see a lot of abnormal cholesterol and lipid profiles because of the diet that we have in this country. As I said earlier, I'm really excited about our omega panels. I think it's going to be really interesting to see how people take that information and use it. Omega-3 fatty acids play such a major role in our overall health and wellness, literally throughout our whole life. And it can affect cognitive function, and it can affect risk of heart disease. It can affect, your child's ability to do hand-eye coordinated movements at a young age. It can affect learning level in young school-age children. So I just think that to me is such an important piece of information that really until now, people didn't have easy access to. But it's something that is so simple to fix just by making some changes in your diet. So it'll be interesting to see what other sort of trends we see with our customers and how they reach back to us and ask about different questions with their test results.
That is so fascinating. Even as a thyroid patient, I didn't know that the risk was as high as breast cancer. That's really, really staggering. I'm shocked by that, actually.
Yeah, in your lifetime, it's overall in your lifetime. And so I always find that interesting. I don't know the statistic for heart disease off the top of my head, but I actually think the risk of heart disease is higher than 1 in 8 for women. And heart disease still remains the number one killer of both men and women in this country. So being proactive about your heart health from a young age, I think is just super important.
For sure. And I'm curious also just what about testosterone in men? Because I get a decent amount of emails from women whose husbands have had low testosterone, like lab tests that shows low testosterone. And I've read that there's been a societal decline in testosterone over the last few generations. Are you guys seeing this as well? And if so, are there things that men can do proactively to help with that?
Yeah, so there is. And I will tell you that one of the biggest factors affecting testosterone levels in men is obesity. And the more a man's BMI increases, and once they get past the BMI of obesity, the more profound effect it has on testosterone production, and the higher their estradiol levels become. So they're getting an imbalance in testosterone and estrogen within their own body because of the increase in weight. So we do see a lot of low testosterone in men. We see a lot of low testosterone in young men. And the first recommendation, it's not go run to that low T clinic. The first recommendation is focus on nutrition, exercise, and weight loss. Because if you can get your body weight back down to a more normal range, your testosterone problem will fix itself.
That's a great point. And one thing I want to make sure I also talk to you about, because you have an expertise in this, is basically the hereditary or genetic risk of cancer, because I get questions about this and I'm obviously not qualified to answer them, so I don't. But I know that that's a concern, and I've had friends who have proactively, for instance, had a mastectomy to prevent getting breast cancer down the road. And I know that you've done a lot of work in this area. So I'm curious, for people who know that they maybe have a genetic risk factor, what kind of advice you give to those patients?
So there's two parts to this. One is knowing that you already have a gene and what are your options. And the second part is, how do you get to the point of finding out you have a gene? So not everybody needs to be tested for these genetic conditions. You have to have a certain either personal or family history of cancer that puts you at an increased risk of potentially having one of these genes, which would then be the reason to screen you for them. So I actually still see patients in a private practice half a day a week. It's, a very small clinical practice. I just don't want to give it up. I really enjoy seeing patients. And in my clinical practice, all I do is discuss genetic testing with individuals who've been referred to me because they have a family history that their doctor is concerned about, and they want to see, should they be tested and they want to make sure that they get all the information before they test. And then the other group of women that I still see are women that have identified as having a gene and being high risk for cancer. And so they'll sort of stay with me and get their routine 6-month screening done. So the first question is always, who should test? There are guidelines surrounding what criteria need to be met in order to test. So there's easy ways to make the criteria, and I'm actually happy to share with you the questionnaire that I use in my office, which is very simplistic, but it takes the criteria that are set forth by the National Cancer Coalition Network, also known as NCCN, and it makes it a yes or no questionnaire, so that if someone has a yes, I know that they've met the criteria for testing. It makes it very easy to identify them when they're coming in for a visit. Once they've identified as testing, we test them. Now, not everybody's going to test positive, and the thing that's really important to remember is you can have a high risk of hereditary cancer because you carry a gene like BRCA1 or BRCA2, or you can have a high risk of familial cancer because you found out you don't carry the gene, but there was enough people in your family with breast cancer that still puts you at a higher risk than the general population. So depending on which one of those two buckets you fall into, you identified a gene, which means you're at the highest risk, or you don't have a gene, but you still have a strong enough family history that we've got to screen you more often, then we can talk about what to do next. There are guidelines for BRCA1 and 2 positive women as to how often they need to be screened, medications that they should be offered to reduce the risk of both breast and ovarian cancer, and surgeries that they can have done to try and prevent the cancer from ever developing. And then under the familial risk, depending on how high the risk is, typically starting at above 20% lifetime risk or about a 1 in 5 chance, then there is recommendations for increase in exams, increase in screening, potential medications. In some cases, if the risk is high enough, meaning like a 1 in 4 chance or greater, then you can also discuss preventative surgery with that group of women. So a lot of it just depends on which bucket of risk do you fall into, how comfortable are you with screening versus being proactive. And one of the things that I always tell women is if you have a BRCA gene, I can do all of the screening in the world, but I will not reduce your risk of developing cancer. With screening, we just hope to catch it sooner. We don't prevent cancer by screening. The only way to prevent cancer is to think about some of the medications that we can offer or the surgeries that we can offer. I think it's really important to make that distinction because I don't want a woman to ever think, well, if I just get more breast imaging, then I won't get breast cancer. No. You're still going to have an 87% chance of getting breast cancer if you're BRCA1 positive. We're just hoping to catch it at an earlier stage. That's why we're doing the increased screening. So I think it's a very important distinction when you're talking to people at a genetic risk that they understand the difference between just screening more often or being proactive at decreasing risk.
Got it. Yeah, such an important distinction.
This episode is brought to you by Perfect Keto. I have heard from a lot of you who are trying the keto diet right now, and Perfect Keto has several products that makes it so much easier and tastier. They have keto-friendly sports drinks with 0 additives, 0 carbs, and only high-quality ingredients. And I've gotten so many questions about this. They also have exogenous ketones that raise blood ketone levels up to 1.5 millimoles per liter. So that would be simulating a fast. A lot of people use these exogenous ketones to increase mental performance and energy production and fat burning without the need to do extended fasting. And Perfect Keto really just helps make ketosis available to everyone, everywhere, all the time without the need to do extended fasting, like I said. You can check out these and all of their other products at perfectketo.com/healthymoms. And if you use the code healthymoms, all uppercase, you can save 20% on any order. This episode is brought to you by SteadyMD, my personalized primary care doctor online. SteadyMD is awesome because it partners you with a doctor who really gets to know you, who listens to you, who has time for you, and who knows your whole medical history and your health philosophy. It's designed for anyone who wants a primary care doctor that they can have access to anytime that they need them. Their physicians see a very limited number of patients, so that way they have time and you can call, text, or video chat them anytime, and you're talking to someone who is aligned with your life and who is focused on you and helping you achieve your goals. Some of their doctors are trained in functional medicine and integrative medicine, others have expertise in thyroid or diabetes, and some work specifically with athletes. I love SteadyMD because now with their new pediatric add-on, I can